Good evening and welcome everyone for our 1719th day of continuous webinar. Today's our guest is Dr. NISHANT DARYANI, is MD in Homeopathy and Chief Physician of Homeopathic Migraine Clinic in Jaipur, Rajasthan. And he has presented papers in national and international seminars, has published 6 articles at peer review journal, and life member of LMHI, AHML, and HMAI. So he has more than 15 years of experience. I'm very happy to invite Dr. NISHANT for our IFPH webinar. You're welcome, sir. Please. Sir, please unmute yourself and okay. So
Am I audible?
your clinic is only for migraine, huh? Is
mainly for migraine, ma'am.
Oh, okay. Okay, that's great. Okay.
Dr. Anjali, you have to make him the co-host.
Yeah, I made him. Now you are the co-host, sir. You can share the slide and all.
Shall I share myself?
Yes, sir. Of course. Yeah. Start. Scope of homeopathy in migraine. Started. It is visible.
Your slides are moving.
Now it is the first page, mentioning your name and email ID.
Okay. Okay. First of all, good evening, everyone. Namaskar, Sani sir.
Good evening.
Respected seniors and dear friends, I'm thankful for the IFPH platform for giving me this an opportunity. Shall I begin?
Yeah, you can start. Yeah, continue.
Yeah. So there is a famous item in medical world. Headache is a headache for both patient as well as for the physician. If we observe the disease trend of past few years, we will observe that as compared to other diseases, more and more patients of migraine are coming to the homeopaths for treatment. Why? The biggest dilemma of the patient is till they uses conventional drugs, they feel better. But as soon as the medicine stops, the symptoms reappear, and this goes on for years together. Apart from this, the patient also feels as the duration of disease increases, frequency of their migraine attacks and its duration also gets increases, as well as the symptoms take more severe form, and for this, medicinal number and their doses has also to be increased. This indicates the present line of treatment is not curative, but palliative or having symptomatic relief only. Homeopathy, being a holistic mode of treatment, plays a vital role in cases of migraine. It not only relieves the pain, but also checks its reoccurrence, thus improves quality of life. Now, International Headache Society classifies migraine disorders into two groups: primary headaches and secondary headaches. So primary headaches occur without any underlying medical condition or pathology, or we can say without any cause, with normal clinical findings and investigations. For example, migraine, tension headache, cluster headache, etc. About 90% patients suffering from headache are of primary variety. The secondary headaches occur due to some underlying medical condition or pathology. Can be identified by clinical examinations or findings or from lab investigations. For example, sinusitis, cervical spondylosis, hypertension, trigeminal neuralgia, temporal arteritis, space occupying lesion, etc. So migraine is a neurovascular disorder, generally hereditary in character, characterized by recurring attacks of headache, more often unilateral in location, irregular in intensity, frequency, and duration, usually associated with nausea, vomiting, photophobia, or phonophobia. In some cases, attacks are preceded by or associated with neurological and mood disturbances. WHO ranks migraine among the world's most disabling illness. Attacks can be completely disabling, forcing the patient to hamper their daily routine activities. Present scenario, the number of cases of migraine are increasing rapidly because of our modern lifestyle, which is full of stress, always running, no time to take rest, irregular food pattern, and fast food culture, etc. Globally, about 14 to 15% population is suffering from migraine. Now, association with age and gender. Migraine is generally seen in people of every walk of life, but more than 90% incidences are seen in the age group of 14 to 50 years. That is reproductive age groups. And it is rare to see a new case of migraine after the age of 50 years. Female and male ratio is about 3:1. Migraine can be broadly divided into two types, migraine without aura and migraine with aura. Migraine without aura, also known as common migraine, is present in more than 90% cases. What we seen in our clinical practice is defined as a recurring attacks of unilateral headache, gradual in onset, remain for 4 to 72 hours if untreated or unsuccessfully treated, moderate to severe intensity, character of pain are usually pulsating or throbbing, aggravated from exertion, and associated with nausea, vomiting, photophobia, or phonophobia. Migraine without aura is common in females just before or during menstruation. Hence, it is called menstrual migraine. And for this, pulsatilla, folliculinum, semicifuga, belladonna, sepia, natrum muriaticum are the most commonly used medicines. Episodes generally tends to get less after the menopause. Now, migraine with aura, also known as classical migraine. In this, headache are associated with fully reversible neurological symptoms, may it be visual, sensory, or dysphasic speech symptoms. Visual aura is the most common aura, may present as patient may feel as scintillating zigzag lines or figures, or there may be flashes or flickering lights, bright or white lines, or there may be fortified spectrum. In rare conditions, patient may feel blurring of vision, black spots, or loss of vision may occur. Cases of sensory aura are very rarely seen, wherein patient may experience pin or needle sensations, or there may be numbness that starts in one hand or arm and spreads to the same side of the face. Speech disturbances are the rarest presentation, wherein there is difficulty in speaking or slurred speech. Now I'm presenting images of visual aura. Firstly, most common visual aura is presence of zigzag lines or figures. For this, Natrum muriaticum is a very useful medicine. Another very commonly seen visual aura is fortified spectrum, wherein patient experience scintillating zigzag lines begins in one portion of the visual field, which gradually enlarges and covers the whole central field, and then it gradually fades off. Again, Natrum and cyclamen are commonly used medicines, and both the medicines are having every type of visual aura. Now, flashing lights or white color spots. For this, belladonna, coca, cyclamen, and Natrum muriaticum are useful medicines. Coca, a well-known mountaineer's medicine, is also a wonderful medicine for migraine at high altitude. Another image of showing flashing light or white color spot. Here, it is seen in the central vision, while in the previous slide, it is scattered form. Group of medicine is same. Blurred vision. For this, cyclamen, gelsemium, iris V, calibi, legdefloratum, and Natrum is frequently used medicine. Black spot or loss of central vision, or there may be complete loss of vision. The group of medicine is same as in previous slide. Now, frequency of migraine is the frequency of migraine episodes varies from patient to patient, may ranges from one episode in a year to almost daily. Based on the frequency, it can be divided into two groups, episodic migraine and chronic migraine. When headache occurs less than 15 days in a month is called as episodic migraine. But when it occurs more than 15 days in a month for at least 3 months, it is called as chronic migraine and categorized under chronic daily headache. And these are the real challenging cases for which it is said headache is a headache. Here I would like to mention that nowadays migraine is considered a psychosomatic disorder, but physical factors are equally important. But while dealing a case of chronic migraine, we should thoroughly inquire about the psychological history of the patient, because in these cases, we will definitely get strong psychological history. And without taking it into consideration, these cases cannot be managed. Now, triggering factors for migraine. The most important triggering factors are psychological triggers. Today's life is full of stress, and everybody has to face a lot of stress in their daily routine. But when they fail to manage or cope up with these stress, it started reflecting on the physical plane, and migraine is one of that reflection. Emotional disturbances such as strong displeasures, disappointments, shock, grief, anger can trigger migraine attack. Post-traumatic stress disorder, anxiety, depression, and even period after stress, that is, relaxing period after excess mental activity or stress. And for this, Iris V is a wonderful medicine. Now, another important triggering factor is hormone. Migraine attacks are often seen around menstruation, around ovulation, in females taking oral contraceptive pills, hormonal replacement therapies, during the first trimester of pregnancy and immediate after delivery, as well as in menopausal time. And this occurs because of the fluctuation in female hormones, specifically estrogen hormone. Now, dietary triggers. Stimulants such as alcoholic beverages and overuse of caffeinated drinks or sudden withdrawal of caffeinated drinks such as tea, coffee, or aerated cold drinks may lead to migraine attack. And for this, Naxwamika, Thea, Coffea, and Thuja are commonly used medicines. Dark chocolates, fasting or missing a meal, food containing aspartame and artificial sweetener used in sugar-free products, monosodium glutamate, a salt used as a flavor enhancer used in Chinese food, frozen food, tinned food, canned food, various soups, various snacks, potato chips, etc. and etc. Nitrite, a chemical used as a preservative and flavor enhancer and protects pink or red color of the packaged meat. It is also seen in aged cheese, pickled fish, soya sauce, etc. Tyramine, an amino acid present in aged or processed cheese, smoked meat, various fruits such as banana, avocado, is mainly seen. Now coming on to the physical or environmental triggers, flashing lights, glare, loud noise, smoking, it may be active or it may be passive, for which ignatia and gelsemium are very useful medicines, strong odors or perfumes, irregular sleep pattern, may it be undersleep or it may be oversleep. Extremes of weather, may it be hot weather or cold weather, but I generally seen it is more seen in hot summer weather. Dehydration is also very important triggering factor for any type of headache, including migraine. High altitude, physical exertion, constipation, and head injury may lead to migraine attack. For this, arnica and natrum sulph are very useful medicines. Another very important triggering factor are drugs. Knowledge of these will help in improving our clinical practice as well. Sometimes we encountered with a patient who is not responding well even after our well-selected medicines. So while going back to the case, we see in the treatment history that patient is taking some conventional medicine, which is actually the obstacle for our treatment. Change of the medicine will solve the problem, but here as well, we have certain scopes. For example, histamine is used to control the allergic reactions. Infrequent doses of homeopathic medicine, histamine will take care of its side effects. Side effects of PPI or antacids like rabeprazole, ranitidine, omeprazole, pantoprazole, etc. Naxwamika can take care of their side effects. Reserpine, a drug used in the antihypertensive and antipsychotic patients. It is prepared from the root of the Rauwolfia plant. So potentized Rauwolfia not only take care of its side effects, but also helps in hypertension. Nifedipine, another medicine used for hypertension. Rauwolfia is equally effective here. Nitroglycerin, medicine used in acute angina or in coronary artery diseases. Clonine is a very useful medicine here. Now, clinical presentation. Migraine is not limited to just 4 or 5 symptoms like unilateral headache of throbbing nature associated with nausea, vomiting, or photophobia, but it's a series of events. And understanding and identification of these series will help us in diagnosis as well. Migraine can be divided into 4 phases or 4 stages, such as prodrome, aura, headache, and postdrome in case of migraine with aura, while aura phase is not present in migraine without aura. So first is prodrome phase. This is present in about 15 to 20% cases, may start or begin few hours or 1 to 2 days prior to the onset of headache. Patient may experience irritability, sadness, wants to be alone, frequent yawning, neck stiffness, hungry feeling, or craving for certain foods. These symptoms are very difficult to get from the patient, as patients generally do not pay attention to these symptoms. But if we get them, are really having importance in diagnosis. And from homeopathic point of view, these are the real concomitant symptoms are helpful in the treatment. For example, hungry feeling or hungry before the headache, sorinum, epiphagus are very useful medicines. Irritability before headache, Naxwamica, Natrum erraticum, Chinnam ars, and Natrum sulph are very useful medicines. For frequent yawning, we have Menispermum, Kali Carb, and Agaricus also. Aura phase. Aura is a warning or signal before the onset of the headache. It starts 1 hour up to 1 hour prior to the or with the onset of headache. I'm already explained this phase in detail in previous slides. Now, headache phase. This is the phase starts at the end of the or during the aura phase. And generally, we see these symptoms in a migraine patients. Now, resolution or postdrome phase. It starts after the headache phase and lasts for few hours to 1 to 2 days. Patient may experience irritability, wants to be alone, confused state of mind, difficult concentration, weakness, oversensitivity of scalp known as allodynia. Many times, patient complaints of sensitivity or pain or discomfort while combing their hairs or wearing ponytails is the allodynia. Is a common feature of migraine, may present at attacks or otherwise as well. And for this, China, arsenic, and natrum sulph are very useful medicines. Now, diagnosis. As migraine is a primary type of headache, there is no specific investigation for migraine. Diagnosis is based upon the thorough clinical history, which includes characteristics of headache and associated features, identification of triggering factors, positive family history, which is seen in 50 to 70% cases, and normal physical examination, that is cranial nerve. Investigation is done in only doubtful cases to rule out the other causes of headache. Now, neuroimaging in a case of migraine. Generally, we homeopaths get the diagnosed cases of migraine, but we should at least have the knowledge that when it is necessary to do a neuroimaging in a case of migraine, may it be a new case or is already a case following under your follow-up. I'm very much sure that you all are very much aware with all these things, but I'm just brushing up your memories. So neuroimaging is very essential when a patient complains a new onset of sudden and severe intolerable pain or headache, unusually prolonged or persistent aura. There is significant increase in frequency or severity of the pain or other symptoms, or there may be change in the clinical features of the migraine. Or if you saw a new onset of new migraine after the age of 50 years. In post-traumatic migraines, which occurs after the head injury. Migraine with changes in orientation or consciousness. Migraine with motor symptoms, which is seen in hemiplegic migraine. Now, present time is of evidence-based results. Merely saying that I have cured this case or that case is not acceptable by the modern world. We have to justify our results with some modern parameters or tools. As migraine is a primary type of headache, lab investigations are always remain normal. So to justify this, International Headache Society has prepared a migraine disability assessment scale, also known as MIDOS questionnaire or MIDOS scale, is well accepted by the WHO and widely used all over the globe. MIDOS scale helps a physician to assess the impact of migraine on patient's life as well as gravity of the case. It is a 7-questionnaire scale divided into 2 parts. First 5 questions helps to assess total number of days impact of migraine on patient's life in terms of limiting their activities at workplace, household, and social activities. The totaling of these 5 questions are considered as MIDOS score and can be interpreted as 0 to 5, little or no disability, 6 to 10, mild disability, 11 to 20, moderate disability, and more than 21 is considered severe disability. While last 2 questions helps us in assessing total number of days patient was suffering with headache in past 3 months and pain intensity. To interpret the pain intensity, pain scale is used, wherein 0 is considered no pain and 10 is maximum or worst possible pain. Now coming on to the homeopathic part, homeopathic medicines for migraine. First is Netramure, the most common medicine for both type of migraine with or without aura. Though it is not the only and specific medicine for migraine, homeopathy follows the principle of individualization, and we have to follow this here as well. So Netramure is mainly suited to emotionally sensitive people who gets hurt easily, are reserved, introvert, and brooding in nature. In Netramure, migraine is generally caused or triggered due to suppressed emotions or grief. Netram is for chronic grief, but for acute grief or symptoms that arises after acute grief is ignatia, emotional hurt or excitement, brooding over past mishappenings, exposure to sun heat, bright light, menstruation, eye strain. Headache gets worse during daytime from sun heat, from consolation or sympathy, and patient feels better from pressure and after sleep. Another wonderful medicine for migraine is pulsatilla, is suited to nervous, sensitive people who are touchy, timid, yielding, caring, and affectionate, and tends to weep easily, seeks for sympathy and consolation. Changeability is the characteristic feature of pulsatilla. In cases of migraine, changeability may be seen in location, sensation, modalities, and accompanying symptoms. Similarly, in frequency, severity, clinical presentation, etc., which makes pulsatilla more useful for migraine. Headache in pulsatilla is triggered from emotional disturbances, hormonal fluctuations, and gastric origin. As the nature of pulsatilla, headache can occur at any time, but more common in evening hours, and patient generally feels better in open air. Now, the medicine for today's lifestyle is Nux vomica, is mainly suited to irritable, easily offended people who are highly ambitious, fastidious, workaholic, or industrious, and impatient personalities who lived sedentary lifestyle and tends to crave stimulants and often suffers with gastric irritabilities, are oversensitive to external impressions. Here, natrum mure is close to the Nux vomica in terms of fastidiousness, workaholic, and industrious nature. But the difference between both the medicine is Nux vomica has the expectations of the same standards with others as well, while natrum muriaticum has the expectation with themselves only, not with the others. In Nux vomica, migraine is triggered due to modern lifestyle, which is full of stress, late night working or party, excess mental exertion, disturbed sleep or eating schedules, junk food or fast food culture, or overuse of stimulants, and from constipation. And patient temporarily feels better after vomiting, but more specifically after induced vomiting is the characteristic of Nux vomica. And opposite to this is IRSV, in which headache generally gets worse after the vomiting. Nux also feels better after passing wind or stool. A wonderful female medicine, mainly adapted to sensitive, irritable, easily offended people who are dedicated to their duties but are indifferent in nature, is the characteristic of sepia. Migraine often related to menstrual problem as well as in menopausal age. Now, a very wonderful medicine and frequently used medicine is belladonna. In belladonna, we see sudden and severe headache of throbbing or pulsating nature, throbbing of carotids, congestion or redness of face with sense of heat overhead and face. Headache generally gets worse from motion, from jar, from cold, as well as from sun exposure. It is also a very useful medicine for this hot summer weather. Another medicine similar to belladonna and frequently used in sun exposure or this hot summer weather is clonine. Farrington in Clinical Medica wrote that it is the first choice of medicine for immediate effects of sun exposure or sunstroke. Cannot tolerate heat in any form. May it be from sunstroke, gas stove, hot atmosphere from sun exposure, or in hot summer weather. The main difference between both the medicine is belladonna feels better from pressure and bending head backward, while it aggravates the clonine. So when clonine is for immediate effects of sun exposure or sunstroke, we have Natramcar for its chronic effects. Patient complains of headache every year in summer weather. There is great debility from heat of summer. Slightest mental or physical exertion exhausts the patient and causes headache. Lachesis is also a very useful medicine for this summer weather. Patient complains of headache every time they exposed to sun heat. But in lachesis, we generally see left-sided headache with sense of heat, and pain generally worse from motion, pressure, and during or from sleep. And patient feels better in cold atmosphere. Lachesis is also a very useful medicine for menstrual migraine, where migraine episodes occur just before menstruation and patient feels better from the flow. It is also a very useful medicine for migraine attacks in climacteric age females. We should not forget gelsemium for this hot summer weather. It's a wonderful medicine, comes with 3D: dullness, dizziness, and in severe cases, drowsiness.
Sir, after belladonna, it's not moving.
I didn't move, ma'am.
Yeah, okay.
I'm
okay.
just comparing the various medicines with belladonna specifically for the summer weather.
Okay, okay, okay then.
Okay, so we are on the gelsemium. Comes with the 3Ds: dullness, dizziness, and in severe cases, drowsiness. But the pain is not so marked or not so severe in gelsemium as with the other medicines. It may have dull and aching in nature, and patient generally feels better from stimulants, from pressure, and from profuse urination. Another medicine for better headache, better from profuse urination is Silesia. Now, another good medicine for this weather is Bryonia, wherein complaint aggravates from slightest motion, even of eyes, and patient feels better from absolute rest. In Asnia barbata is also very useful medicine for sun exposure or in summer weather. Patient feels as if temples would burst or eyes would burst out of the sockets, as in sanguinaria can, and feels perfectly fine after the sleep. Now, sanguinaria can, a useful medicine for sun headache, as I explained, has a characteristic right-sided headache along with common symptoms of migraine. Pain starts from occiput or nape of the neck and settles over right eye. Similar presentation in opposite side, that is left side, is for spigelia. Silesia is also having the similar presentation as sanguinaria, but Silesia is more useful in winters. Headaches are generally worse from cold air or draft of air, and patient feels better from profuse urination, from warmth or covering the head. Scutellaria, another useful medicine for nervous sick headache caused by excitement and excess mental exertion, also known as school teachers' headache, though it is also useful in students and people involved in excess mental exertion or more over mental activities. Another good medicine or useful medicine for migraine caused by excess mental exertion is picric acid. In picric acid, headache is generally seen in occipital region, and patient feels better from pressure, applying cold application or water, or after head bath. Patient may also feel pin or needle sensation in upper limb, or there may be burning in spine as seen in phosphorus and caliphos. And as an acid, complaints come with great prostration. Iris versicolor, a wonderful medicine for vacation headache or weekend headache. That is, relaxing period after excess mental exertion, especially during vacation. This is the only medicine given in synthesis repertory for this condition. This type of headache is generally seen in students, teachers, lawyers, scientists, etc., who involve in lots of mental activities. These people remain at ease when mentally occupied, but on getting free or relaxation during vacation or at weekend, they develop headache. That is why it is called vacation headache or weekend headache. Here, one thing I used to say, that it is very unfortunate for the teachers or people involved in over mental activities, excess mental activities, because they suffer from both the sides when they perform their duties sincerely, and even suffer when they try to get little ease. But dear friends, homeopathy will take care of both the situations very well. In IRSV, headache starts with blurring of vision or loss of vision accompanied by severe nausea, vomiting, which does not relieve the headache. And pain gets worse from rest, vomiting, and after relaxing from mental strain. And patient feels better when occupied in routine activities. Epiphagus, a remedy known for shopping headache, is suited to one who enjoys shopping but return home with headache. Shopping is not just a thing to go somewhere, buy something, and just back to the home, but it involves a number of events or series of events, such as over physical and mental exertion, exposure to crowd, different atmospheres, different temperatures, bright light, various smells. It may be pleasant, it may not. Mixed emotions, feeling of mixed emotions, might be pleasure, or there might be irritation or frustration, or food deprivation. All these factors may trigger migraine attack, and epiphagus is a very useful medicine for this. It is also having one strong concomitant, that hunger precedes the headache. Another common medicine for both type of migraine with or without aura is leg deaf. The features in leg deaf are similar to Natrum muriaticum, but not having the mentals. In leg deaf, headache is associated with obstinate constipation. Cyclamen, a wonderful medicine for retinal migraine or migraine having visual disturbances, such as fiery sparks, spots of various colors, glittering needle, flickering countless stars in front of eyes, dim vision as of fog or smoke, partial or complete loss of vision may occur. Another very wonderful medicine where episode starts with loss of vision followed by severe headache. Sight returns as headache increases, associated with nausea and vomiting. Kalibai is the only medicine given in Kent repertory for loss of vision followed by severe headache. There are other medicines for loss of vision followed by headache, but not for severe headache. And these are cyclamen, IRSP, gelsemium, Legdef, Natrum muriaticum, and Sorinum as well. Sorinum may be considered when well-selected medicine fails to relieve, or otherwise as well when the headache occurs with hunger precedes the headache. In Kalibai, headache occur in small spots, can be covered by tip of finger as in Ignatia. Pain in Kalibai is generally seen in forehead or over eyebrows, but can be shifting in as well. On Osmodium, a medicine where migraine with prominent eye symptoms, pain in around, especially left eye, may extend to temple. There is heaviness or strained feeling in eyes, which gets worse from constant or overusing of eyes. Better from closing eyes and from rest. Another medicines for headache or migraine caused due to eye strain is Natrum muriaticum, Argentum nitricum, and Ruta. But when the best selected medicine fails to relieve, we should think of tuberculinum. It's a very useful medicine and wonderful medicine for migraine caused by eye strain. It can be otherwise can also be used when there is strong history of tuberculosis in person or in the family. Eusnia, I have already explained. Nicolium. Apprehension is the characteristic of Nicolium. Is suited to migraine patients who are in great fear of developing migraine attack whenever they go away from their hometown or from their physician. These apprehension or fear may trigger migraine attack. And for this, Nicolium is a wonderful medicine. It not only relaxes the mental state of the patient, but also reduces the chances of migraine attack. Thank you very much.
Thank you, Doctor, for your calm and beautiful presentation. It was wonderful. Actually, I think you have 15 years of experience in migraine, right? It's a great thing. And my question is, how you came to select migraine only? Even you are not selected the headache altogether. You have selected only the migraine. What influenced you to select migraine?
My father, ma'am.
Oh, okay. He had
when I entered in the PG, MD, I was searching for the subject, what to do, what should I take. Then he suggested this is the burning problem of today's lifestyle, wherein the conventional medicine has no scope and patient will only get benefited with the homeopathy.
Okay.
And I started, and then I pursued the MD in migraine and continued my practice in same as well.
Okay. Okay, thank you, doctor. And now we have
Thank you, ma'am.
Dr. Hariharan has raised hand. Okay, doctor, you can unmute yourself and ask question.
There is a hello, doctor. Very confidence building
sir.
class.
Yeah.
Thank you so much, sir.
Confidence building class. That is my opinion. See, one case I like to suggest. I got yesterday is that one anemia case, and she is when she is having migraine, and a lot of homeopaths tried for that case but failed. But when she came to me, I am also puzzled. But a lot of medicine, a lot of homeopaths are given a lot of medicine. But see, she is having anemia, so she suffers migraine. So when I gave medicines and corrected the anemia, that migraine disappeared. So your investigation, you said investigation also should be done for this migraine. That is very correct.
Sir.
Thank you,
Okay.
doctor.
Very nice. Thank you very much.
Thank you so much, sir.
Okay.
Thank you, Dr. Mahmood Saida. Okay, please unmute yourself and ask question.
Sir, am I audible?
Yeah.
Yeah, thank you very much. Can we use the principle of prophylactic activity of the remedy in some recurrent cases of migraine? I mean that you can give the remedy without symptoms in order to prevent the symptoms to be expressed. Is the principle applies in homeopathy? This principle is applied in allopathy, but I have no idea what's going on in homeopathy. Thank you.
Okay, what I understood, he's asking for the prophylactic medicine.
Yes.
Yes.
Yes, the prophylactic medicine.
Sir, as the principle of homeopathy is individualization, right?
Yes.
So what the individualization is selection of constitutional medicine. Constitutional medicine will not only check the acute episodes, it also checks the tendency of the patient of migraine attacks. It is called the, what we say, therapeutic cases or prophylactic cases. But not there is any medicine which we can say this is prophylactic or other is specific for migraine, because it has a wide area which cannot be pinpointed.
Thank you, sir.
Okay, thank you. You have mentioned here about epiphagus in shopping headache.
Ma'am.
Yeah, now I am confused about because I have sun headache. So sometimes after shopping, when I'm coming after shopping, also it gets. If we are going into the AC shopping mall, and then also it will. I am confused whether I have sun headache or shopping headache after you are saying about the epiphagus. Maybe because of I mean the stress during the shopping, right?
Yes,
now
ma'am.
after attending your class, I am realizing that.
It's my pleasure, ma'am. That's something I have given.
No, you have given you have given a C. I took one one cup of water from that. Dr. Danesh.
Yes, Dr. Nishant, it's really
Hello, sir.
it's very good session indeed. And you, as you rightly point out, it's your father who really advised you to look at this migraine, and you are doing excellent job in that way.
Thank you so much, sir.
Very good reputation, keeping the reputation in a big way also. Thank you for that. And
Thank you so much.
we used to say that the migraine is most of the migraine cases when people used to come to our clinic and they used to say that I have a problem in migraine and I'm taking a lot of medicine for me and the specialists for that. But when we look into some of the cases, we can find that some of the cases are really typical sinusitis or sometimes due to nasal septal deviation, allergic problems. But still, whenever they have this headache, they used to say that it's a migraine. So migraine is used in a misnomerous way by some people in that way.
Absolutely, sir.
Yes, but but the real migraine cases, when we look into the case, we can find that it is due to certain mental stress or mental ailments or due to that. And what's your opinion on that? And how will you proceed? For example, people used to say that I used to get severe migraine when
Yeah, everyone is saying like that. I have migraine.
and yes, because they were taught in such a way that it is they are having migraine, but actually they may have some other stress problem, but they hide it. But when you go into the depth of the case, you can find that it is due to this mental stress, or for example, for some love failures, or I still remember a case some 24 years back. A patient came with the migraine and used to say that I am having treatment from a lot of doctors for this, and I say when I ask when you have this first episode of migraine, oh doctor, when my child was born, my first child was was an early death, but by about the age of 3 due to bad treatment from the other side. So thereafter, 1 month, I used to get this headache and I used to consult a lot of doctors, and still then I'm suffering. But when I inquired about the depth in the case and found that the patient is still narrating the history, just like her child was dead yesterday. So that much of depth was there in the case. And what's your opinion on that also?
That is why I said in chronic cases and long-standing cases, we will definitely get some psychological background. And it is very essential and very important to get this. Otherwise, these cases cannot be managed. Just, it's okay, taking relief, but not cure. For cure, we have to take it a whole, not as a part.
Exactly. We will have to look into that case in depth. Thank you, sir. Thank you very much.
Manish, we have 2 more participants. Only we have 1 minute. Within that limit, Dr. Ashok Madan and Dr. Ram Parvesha. Dr. Ashok Madan, you can ask your question as fast as possible.
Good evening to all of you, and especially to our doctor. In a brief system, the example of a patient is a lady of 55 years old, having this headache from 10 years on, and not always, only on the back side of the ear, this bone, this one. First, she is natrium muriaticum and she was cured with the constitutional remedy sapia. But bryonia was helping for many things. Then after the situation was belladonna. Belladonna on and off helps very good, but still she can have an attack of that headache on the same place. How I will manage that indication?
Dr. Ashok Madan, can you do, doctor, can you, chat with Dr. Nishant? Otherwise, you can directly ask him about this, because we have another session. Now it is a time to begin the next session. Dr. Nishant?
A short answer can be given.
Please do that.
Can you give short answer, doctor?
Ma'am, actually, I couldn't understood what he wanted to say.
That's why I'm telling. Please put your phone number here. They will talk each other. That will be more nice. More, they will get more idea about that.
Sure, sir.
Dr. Ashok Madan, so sorry. Okay.
No
Uh,
problem. Thank you, doctor. Thank you
Thank you
very
for
much.
asking question and thank you for coming forward. Thank you so much. And Dr. Rom Parvesha, please tell your wishes in one word.
Thank you, Anjani, and congratulations, Dr. Nishant Daryani.
Thank you, sir.
Very good explanation. Headache and migraine, lot of medicine.
Sir.
But natrum mu and tuberculinum, the
Sir.
very good remedy, and emotional cause. इमोशनल कॉज तो
Thank you,
आप
sir.
का जो माइग्रेन का केस विरासत में मिला है, माइग्रेन का जो स्पेशल पिताजी का, तो एक हिंदी में कहावत है,
Sir.
बापे
Thank you, sir.
प्राप्त
Thank you.
घोड़ा कुछ न
Now-
कुछ थोड़म थोड़ा. चलिए, बहुत very very
Thank
thanks.
you, sir.
Thank you,
so
sir.
much.
Thank you so much. Now we are moving
Thank
to
you.
the Malayalam session, and I'm inviting Dr. Manoj for moderating Malayalam session. And thank you, Dr. Nishant, for your
Thank you so
wonderful
much, ma'am. Thank you,
session.
everyone.
Come again, and
Sure, ma'am.
thank you participants for being with us. Bye bye. See you tomorrow, same time.